Ladies and gentlemen, could I please invite you to take your seats? Feel free to come forward. You know you want to get closer to the action. Welcome back. I hope you've had a wonderful lunch. Managed to get some of the ice cream and popcorn. We failed again, huh?
Not again.
Okay, next year. Now, I also hope you all had your chance to do the carbon calculator. We're going to have a look at the results in a little while. But to kick off the second part of the program, we're now going to move into the part of the program that looks at how healthcare contributes to the climate crisis. As we explore the delicate balance between health and the environment, and as we've done so this morning, we confront an uncomfortable truth. We, the very industry designed to heal, also brings a lot of harm to our planet. And I think it's been quite sobering as we've heard some of the facts and data this morning. Many of us, of course, realize this, and there are many of us starting to act to reduce the carbon footprint of our care processes, but we all face challenges in really driving that change. And many of these challenges are related to the pillars of healthcare, such as infection control, finance, supply chain, and leadership. But are these pillars truly obstacles, or do they also present opportunities and strengths that green champions can leverage? Let's bring on stage some experts and practitioners in these 5 areas, these balancing acts, and see if we can find out more about that.
Great. At this point, I have to apologize for my voice. Not very sustainable at this point in time. But let's welcome our moderator, Professor Jonathan Gray. Okay.
Thank you very much, and welcome back. We've got a very exciting session ahead, and I'm Jonathan. I'm a doctor and manager, and my passion is growing young leaders who are equipped to deal with these increasingly complex challenges that we face. I think it's time to invite up my colleagues. So we face a massive challenge, as we heard this morning, but I come to Singapore because we can learn from you. You're an amazing country, amazing people, and I think you're going to meet 5 more amazing colleagues this afternoon who can share a little bit about their work so far and give us a little bit more hope about the way ahead. I'm going to invite all 5 to come up and take their places, all pre-ordered, so please take your places on the seat. Please welcome everybody up. I'm sure this isn't deliberate. We've got our clinical colleagues on my right, and we've got our procurement and finance colleagues on my left. So this is going to be really exciting. The way this is going to work, each of my colleagues is going to have 5 minutes to say a little bit about their work. And then we'll move around the couch to the next person. And then at the end of those sessions, we'll start taking questions from Slido. So please do put your questions on. And please upvote the ones that you're really, really excited to hear answered.
Hi, I'm Brenda Ang. I'm an ID doctor in Tan Tock Seng Hospital and NCID. I'm also the chair of infection control in this hospital, which I've done for maybe a bit too long. And I think the title of this session is 5 Balancing Acts in Healthcare Sustainability. So they've given me something which I think is reasonably difficult. It's about infection control and how we can balance that against being sustainable and try not to waste too much resources. Like a very good compliant person, I actually prepared slides, and I found out the rest of the people on my panel haven't. So I've told the organizer that they're giving me too much homework. I think my Chief Financial Officer, Paul Yong, is here too, so I'm hoping that he can add a little bit more to my performance appraisal. I think CMB is here in the audience as well. So infection control and how does that impact this whole idea? I think the whole theme for these 2 days conference is how we can be sustainable and how we can try not to do too much damage to our climate and environment. And I thought I'll go back a little bit, this whole idea of infectious diseases and infection control. And I'll take you back several thousand years, go back to the time of the Romans and the Egyptians, etc. And man has always known about infectious diseases, although we didn't know what caused them. So previously, you would have blamed it on bad air, miasma, contagion, all these things, because we didn't know there was such thing as bacteria or viruses or fungi, etc. And that's why you would have Asian pictures where there's, healing baths and waters, etc., etc. And then some of you may have seen this picture. It's fairly well known. This is the original PPE or personal protective equipment used by those who may have attempted to be physicians and trying to enter the houses of people who may be sick or dying of plague in medieval Europe. Those of you who worked with us, and of course the last 4 years of COVID, who hasn't known about the idea of PPE? You wear a gown, like in this picture here. That time, of course, they didn't have plastic. They would have made it of materials like linen or wool or leather. And note the beak in front of the nose. That's to put smelling salts inside so that you would not smell too much of the people who are ill or dying, all right? So think now about how this one reflects to what we've been wearing for the last 4 years. Those of us who have had to handle COVID patients, you will know what I'm talking about. And even a long, long time ago, people knew that if you want to cut an outbreak in its tracks, or you want to decontaminate or get rid of infective organisms, the best way is to incinerate or to burn it. Okay, so think of these concepts because in a way we haven't changed very, very much from long ago. So I'm an infection control person. I did see some of my infection control nurses in here somewhere, or maybe they just came for lunch, I'm not sure. So infection control is very important, not just for me and for them, but for all of you as well. And some of you may ask, why do you need to know about infection control? Well, our task is always to prevent transmission between patients, transmission from patients to us, the staff. So we need to think of how to protect ourselves. And very, very rarely, we try to make sure that our staff don't infect our patients. All right? So you think about these concepts, and all that we've been trying to do all these years is to maintain these principles. This is a hand agar plate made from having someone, it was a healthcare worker, putting his palm print on an agar plate. And I use this slide to try and tell my medical students or my medical officers why they need to wash their hands or to do hand hygiene in between. You all had lunch. I'm not sure how many of you people wash your hands before lunch. After seeing this picture, I'm sure you will every time you before a meal, and of course before you touch the next patient. Some of you who are actually in patient care, you will remember this picture the next time you go to the wards or to the clinics. And of course, those of you who are in this hospital with me, you know we have all these posters for people to tell them when they need to do standard precautions. So this is for every patient. And I'll just run through this because I know I'm exceeding the time for the next speakers. But you see that you use gloves if you're going to be handling blood and body fluids, etc. At the bottom of the lower part is a needle, someone doing an injection. A line there that says that you use a new needle and syringe every time you want to give an injection, okay? So part of that reason is, of course, because we're always afraid of spreading blood-borne viruses to other patients. And I bring this up because they all have impact on resources that we need to use in our daily lives. And the theme of this conference is supposed to be, how can we be sustainable? So can some of these practices, do they actually synchronize with sustainability in the long run? Then, of course, besides the normal everyday things which you all handle, MRSA, CPE, etc., those who work in acute hospital care, the other thing, of course, is we're always very worried about this, which is the emerging infections. And there's also old infections that are re-emerging, all right? So when it comes to something like this, you have all these horrible things. I know some of you are not in healthcare, but for those who are, you're not infectious disease people, but these are horror terms that we hear all the time. So I can go on and on and on, because this is not even all of it. You can see this all over the screen, it's all over the world map. Every time you have a new, unknown, scary disease, what do infectious disease and infection control people do? Where we recommend precautions, we have to tell you to protect yourself. So we end up dressing you up a bit like this, not very dissimilar to what I showed you earlier about what you would have worn if you had to handle someone with plague in 16th or 17th century Europe. But think about this. When we use this for emerging infectious disease, the traditional infection control teaching is that you use and then throw after you've seen that patient and change to a new set before you go to see the next patient. That's okay if you only have one patient. If you have 100 patients that's being seen by 6 nurses each shift, you multiply that, that's a heck of a lot of PPE being thrown away. And I think that was how we started for every new emerging disease that we had. But of course, I think people are now coming round to their senses, and then these are 2 editorial comments that were written. One is in JAMA, one's in ICHI. And I think people are now questioning, infection control. Do we have to rethink all these recommendations in the light of the climate crisis? And in a way, some people have also questioned, is there evidence for what we do? I mean, this recommendation for gowns, gloves, dealing with things like MRSA, which is common. I think a lot of you will know MRSA has been around since 1985, and yet we're still doing the same thing as before. And some of these recommendations came up from health authorities when they were actually not backed by good research. Of course, people can wave the patient safety banner and say, we need to do this because we need to protect our patients. And some of us may say, well, it's our ingrained Singaporean culture of being kiasu. For those who are new to Singapore vocabulary, that means extra overly cautious. And of course, people will say you need more evidence that you don't need all these contact precautions. I think this is a picture of Dan Uslan, who is an infection control practitioner from UCLA, and he is trying to start this movement of dismantling some of those precautions that we've been practicing for a very long time. And then, of course, the other thing is, I mentioned PPE. If you have to use and throw for every patient, that's a lot of PPE. If it was 1 or 2 countries, maybe not so bad. But you and I know that the last 4 years, every country almost has been affected by COVID. And initially, people were doing this, use and throw, use and throw, use and throw. There have been times where we had to do the opposite, which was going by using whatever you had, reusing it, or using for a very long time. And that's what we had to do when in SARS 2003. So this whole idea is, can we contravene the usual precautions by either extended use or reuse? I think will require evidence. On the other hand, you may not get evidence. And of course, now people are also saying, why can't you recycle or sterilize them? I think someone was talking to me about it earlier. It's not that easy, actually. People have talked about alternatives. Why can't you have antimicrobial coating of your clothes, etc., so that you don't have to wear an apron and gown over your clothes? Again, easier said than done. A lot of those things may actually be unknown in terms of effectiveness. And then, of course, people have talked about, can't you coat your environment so you don't have to worry about cleaning and changing all the time? Can be done. Copper, silver, super expensive.
And Dr. Brenda, we'll need to stop there in a second.
This is my last slide. I'm sorry. It's a balancing act, infection control and sustainability, because it's all those things. So it's time, money, humans to do all the things that should be done. And I just show a picture of the planet that's being asphyxiated by all the extra PPE that have been used.
Yeah.
Okay.
Thank you very much. A round of applause, please. We'll hold the questions, but please do put them on Slido, and we'll look forward to seeing them. If we can move on, thank you again, Dr. Brenda. Dr. Poh, please.
Thank you. Thanks, Jonathan. My name is Peiki, and I'm an anesthetist at National University Hospital. So a little bit about myself. I'm Singaporean. I moved after secondary school to the UK and lived in the UK for about 17 years before coming back, having finished my anesthetics training. In a sense, my experience in the UK has actually changed a lot about how I think about sustainability and why it's become a really important part of daily life, and why I embarked on the project that we do in our hospital. So people know me as the desk fluorine man otherwise, because of our efforts to try to reduce the impact of anesthetic gases. But really, this started because during my time in the UK, I mean, we know that the NHS doesn't have a lot of money. So that is the reason why, partially the reason why, NICE was set up, to provide good, effective care, but at, the best value possible, and to use that to guide our daily practice. And that has actually influenced, the way a lot of us clinicians in the UK practice. So when I came to Singapore back in 2021, one of the first things I noticed was there was quite a lot of usage of desflurane, almost rampant, and much more compared to where I was from. And I saw the need to do something about it. So we did a series of education sessions, inviting experts from overseas to talk about the problem to our department, as well as putting stickers on the anesthetic machines to remind people and give them a little nudge about the environmental impact of what anesthetic they're delivering per hour. And this actually had a this had a good effect of bring numbers down. One of the things that people ask is, it's only desflurane. It pales in comparison to a lot of other things. So why are you doing it? I think we need to think about environmental sustainability as being more than just about protecting the environment. Environmental sustainability actually affects everyone around us. In the UK, they actually there's actually a lot of focus on social equity, on social justice, and making sure that everyone has a certain standard of living, and a means to achieve a relatively good livelihood, whether or not you're poor or whether you're old. And I think the same should apply to us clinicians in healthcare, in that everything that we do has an impact. I mean, we could turn on an anesthetic gas with high global warming potentials for a few hours, and say that my patients wake up a few minutes faster. But does that actually translate to any benefit or tangible benefits in terms of recovery? And that's the thing we have to balance and act with the knowledge that we have. The same thing could be applied to other things to do with our daily practice. Think about the proton pump inhibitors that we prescribe. I mean, Singapore being Singapore, we always like to be on the safe side of things. Most of the patients, when I go on pain rounds with my juniors, most of the patients who are prescribed, COX-2 inhibitors have a PPI. And is that actually necessary? I never saw that practice in the UK, but this was, especially rampant here. In operating theaters, we prescribe dual antiemetics for all our patients. But again, is there a need to? And I always tell my juniors that there's really a need to justify your actions. Every single action that you do, you need to think about it and whether or not your patient is going to benefit from it. Because if you don't, then that just constitutes low-value care, where it provides no, if not minimal, benefit to our patients and potentially complications as well. So I think, it's an exciting time, and, and as Singaporeans, we need to think hard about, the daily choices that we make. I think in the panel talk during the morning session, one of the things that was raised by Jasmine was that, Singapore, we have always wondered, are we victims? Are we the victims in the whole grand scheme of things? Make no mistake, I think, things have changed. We are no longer a low or middle income country. We are a high income country, and in terms of, healthcare admissions per capita, as what was, alluded to earlier on, we place second globally, just behind the States, at about I can't remember, I think it's about 1.5 tons of CO2 E per capita. And if we don't rationalize what we use, and if we don't take stock of, those things, then we're going to blow the budget, and, not just, financially, but environmentally as well. So exciting times ahead, and I hope that, all of you, will take the next step forward in your sustainability journey. I just realized as well that I'm wearing the same suit and shirt as the picture up there. Yeah. So I've not actually gone shopping, but I assure you it's been in the wash, all right?
Thank you. Please thank Dr. Pull. Thank you. Very good. And remember, keep those questions coming in Slido. Please log in and send us a few more questions. Now over to Associate Professor Wan Cheng, please.
Thanks. Well, there are so many aspects of sustainability. Totally appreciate what Peiki is talking about. I mean, he talked about, on top of environmental sustainability, he talked about financial, and together with it, equity. And then Brenda talked a lot about the tension between keeping the patient safe and at the same time keeping the planet safe. There are so many aspects, but I think I will confine, for the purpose of this, on the environmental sustainability. And just to introduce myself, I forgot. So I'm Wan Cheng, and my work has no direct, nothing directly to do with sustainability officially. So I'm a gastroenterologist. I specialize in viral hepatitis, and I do liver transplant. And currently, officially, my job is, a lot of it is management. I'm Vice Dean in Duke and US for academic medicine. So I support and promote education and research and things like that in the academic world. I guess there's always this little part of me who agree that equity is important. So before I even kind of go into this journey of sustainability, I was involved in setting up the Global Health Institute, then not too long ago, supported the setting up Medical Humanities Institute. And if you think about it, they seem to be all different, but they are actually all about the same thing. Whether you talk about global health, is equity and humanities, and sustainability is very much a big part of humanities, the way I look at it. Why did I come into this? It sounds like it's a new thing, but as I was asked to talk about this, and Hong Ni told me that it's about balancing it. So I'm not going to talk about, what needs to be done. I think whoever here are convinced what need to do, but he was saying, you're supposed to be into education. Why are you doing sustainability? How do you balance that? So I wanted to say that actually they are not in conflict at all. And I'll explain just a few minutes why do I say that. So looking at my own journey, I would say that as a clinician first, and later on going to administration and leadership role, it sounds like nothing to do with sustainability. Then as I was thinking back, I remember before Singapore has all this recycle bin more than 10, 15 years ago, I used to bring this junk mail because there's no blue bin at the foot of my house. I used to bring this junk mail and carry them with me to bring back to the hospital because that's the only place where there's a recycle bin. So I used to be this silly person who carried junk mail to work. So I guess that's in me a long time ago, funnily. Then, of course, before I get my current job, I was chair of medicine in my hospital. And when I was chair, so I was this woman in the C-suite, so to speak. And I would have this all my fellow C-suite colleagues who say that, we have think of another solution, I must say that they mean well, and there's a good justification for that. That we have to use the next single-use instrument, and the next single-use, even, Brenda will agree that you need to for IV plugs and things like that. And every time they change to something single-use, I would say, what? So it's kind of me, and I always thought that that's just me being a global citizen, nothing to do with healthcare, and that's where my heart is. Then come COVID-19, and of course the national movement. I mean, Minister Grace Fu was here. It was COP27. I think we still do very badly Singapore in COP26, and we're saying that we are not doing enough. I've been following COP. And then when COP27 comes, suddenly Singapore become more awakened, and of course it was in the midst of COVID-19. And then my CEO kind of come to me, I've already stepped out of C-suite, I'm doing my current job now. He said, we are thinking maybe you should go into sustainability, blah, blah, blah. Do you think it's a good thing? Then obviously I said it's a good thing. The next thing is I'm the chair for this work group, not my official job, but as I said, it's not paid for it, but it's something that I believe in, and I decided doing it. And why? Because I always say to the young people who has a lot of burnout problem, I think a lot of time is you can't see the meaning in what you do. If you see the meaning, burnout become less of a problem. So I guess I see it, but when I see it and I start doing it, and to not just do it because I believe in it, and to convince other people to do it, I think a bit deeper than just what I believe in doing, and start looking at the literature and become very clear why I should do it and what I should say to convince my colleagues. And I just realized that it's not about just throwing the junk mail from my home or just protesting about single-use equipment, but really, if we think about it, I have, talking about supporting research, I have my respiratory faculty who in fact work with our LKC colleague and publish a paper on how heat increased the fungus, they were talking about air pollution, fungus spores in the air, and how that has increased COPD, obstructive lung disease. We now know that despite smoking has decreased in some quarters, but CA lung is going up because of air pollution. We have every reason to say that the OT has to be cold, but it's so cold that we are emitting a lot of heat outside the environment, causing people in the already very hot temperature to have, obviously thermal stress and all the things. And then they come back into our hospital, either for COPD or for CA lung or for heat stroke to treat them when we create half the problem. So I thought, it's so ironical that we are supposed to save people, but then in the process of saving people, we generate more problem to cause more people to come back to us. Maybe it's a way of, if we are interested in medicine as a business, it's a way of generating business, and the microplastic that's causing so much problem, and we produce more plastic than everybody else. So I guess I would just want to say that why I want to do it, I think the reason is clear. Is it consistent with education? Absolutely. Because I think what we were taught in school is still valid, but there are so many things more we need to teach for the next generation. Digital literacy, data literacy. I want to add sustainability, because we just have to change the school curriculum, and that's about it. But which will take another generation, I hope not so long. But in the meantime, one of the things I've learned that I have to work with very, very closely when I was trying to, herd everybody. Of course, I have a lot of colleagues who are already on the same page. That's why we can work along. Is the CFOs, that we absolutely need that support to say that, not every time when we spend is always a waste. Now I'm so glad my CFO come to me instead. He said, we are going to pay carbon tax. I said, yeah, that's why, this is called investing upfront, may have savings later. So we should do something about that. But the other important group of people I realized that we should respect and work very closely with is our comms colleague, because it's about changing culture. And I think that takes a lot. And I keep begging my comms colleague that, of course, they have a lot of message they have to disperse and percolate, including infection control. But it's to get our comms colleague to be on our same page of us to work this together. Thank you.
Thank you very much. Please. That's great. I think everyone picked up your enthusiasm there. That was fantastic. Thank you so much. I'm going to turn to Nina now as well. So Nina, over to you.
Hello, everyone. I'm Nina. I'm the Chief Procurement Officer from ALPS. Really glad to be here. In my day-to-day job, since everybody talking about the CFO, I think I probably start with the my day-to-day job is really the three priorities, like I will say. Very first one is the cost containment, right? No matter we are talking about sustainability or we are talking about the resiliency, it's all at a controlled cost, right? What will be the best value that we've been looking at? The second one is that I'm really adapted into the AI application in procurement. So one of the priorities for me is looking at procurement digitalization to improve our efficiency and digital, the productivity. The most important among all these three will be on the sustainability. I've been in the chairperson for sustainable procurement 3 years ago. It has been a very fruitful journey. Maybe I'll just take the opportunity to share with everyone what has been done, some of the initiatives. The very first one is really about awareness, making a public commitment. The very first thing that we have done from ALPS perspective that we have been dealing with close to 3,000 vendors. We send the email with our commitment saying that ALPS representing as a procurement agent for all the three clusters for public healthcare, we are committed to reach the target of net zero. And that has been sent out to all our vendors. And from all the 3,000, we have shortlisted 250 vendors based on the spend that invite them to join us on the carbon reduction program by reporting on their corporate level what is their commitment to net zero. A simple yes or no, but as well as if they are able to quantify, to have the carbon accounting methodology, or if they have any plan to reduce their carbon footprint. And out of these 250, that we further engage about 50 vendors on an annual basis. We have a dedicated session to talk about sustainability, talk about carbon reduction plans. How can we jointly making the efforts to reduce the carbon footprint, especially based on our scope 3. While at the same time that we can understand their strategy, their corporate strategy, especially for things that they can control, their scope 1 and 2. And from there, we can understand the maturity of their sustainability in their respective industry. That is all about the awareness. At the same time, awareness is not only with the external vendors. We spend allocated amount to upskill all our MMD, all our buyers. We attend the sessions that by our local polyclinics, procurement, sustainability procurement and supply chain courses, which is a compulsory training course right now for all our buyers. And we would like to upskill our buyers, knowing how to lead, how to influence and collaborate with our end users to do the low carbon procurement. And this is the investment that we think is very important as the baseline to create awareness, to equip our buyers with the knowledge to move forward. And the other important step that we have been doing is the full alignment with the cluster institution senior management. I'm so glad to understand from yesterday that Paul has approved 200K, right, for endorsing on this investment for sustainability. So similarly, we have been reaching out to the group level C-suite, the group CFO, each one in the NAG, and then the counterparts in other clusters to align the commitment. It's not only ALPS senior management, from all the way from CEO down to every single buyer. It's all of us that are committed to align on this effort. So that is the second part on this awareness. And we also reach out the collaboration with the institutions, COSM, the Center of Sustainable Medicine. So we started to explore the carbon footprint baseline calculation, right? So today, I'm so happy that this Sustainability Academy has been launched. I'm sure there will be more and more collaboration, training, and our journey to explore on these carbon calculations, some of the toolkits as well. So last year, we have been working with NUS Business School, coming out with these decarbonization toolkit. We don't have a perfect tool yet. Well, something that we can start with. So our dream is really, by the end, in every single sourcing activity that we have, we should be able to have the information from the vendor to say, at a corporate level, yes or no, do they have a plan to reduce the carbon footprint? And ultimately, come to our product level, what can we do? And we hope that there's a central system to track all this information so that we can start to measure our performance. I think yesterday we joined a session, the masterclass by Sonia. That has been a very enlightening exercise for us because benchmarking across the world, we are moving towards the right direction, right? None of us have a complete system at this point in time for carbon accounting. Well, we are making progress, at least that right now, together with some of the clusters that we have collaborated. Instead of working on the activity-based, right now we have a very prelim spend-based carbon emission data to start with. That will be our baseline. At least that's something for us to start with. Moving forward, that we have been working on the guideline of procurement policy. Everyone's behavior, I mean, every one of you is my stakeholder. Procurement activities really involve every single users within the organization, from the clinical, from the admins, nurses, and etc. So from early 2023, we already pilot out this new methodology to evaluate our quotation. We used to use price and quality, the PQ methodology. So last year, we started with the E element to be part of the evaluation. So E, to start with, is embedded part of the Q. The intention is really, when we evaluate all different categories, all different industries, especially local Singapore, we don't want to disqualify all vendors, right? And we also need to manage the cost. It doesn't mean that we are willing to pay a premium in order to get a biodegradable kind of products. So we say we leave the option to our evaluation committee. E can be part of the quality to start with, and we use up 1 year time to test out the market. Where are we? And from this year, we officially change our procurement policy into PQE. So E, it can be an official element in the overall evaluation, and it can be up to 5%, 10%. Final decision is with the evaluation committee based on the individual industry's maturity in terms of sustainability, right? This is a significant progress, advancement in our, because we are the one that dealing with the vendor. We are sending the signal to the vendor, to the market. We are saying that this is the way we want to move forward, and we are serious about it. And you know what? We are able to change. We are able to influence this market to move towards the net zero. And ultimately, it's a joint effort. So here, I really seek everyone's collaboration. Everyone need to help us, help procurement to make a wise decision to value sourcing and with the sustainability into the consideration. Okay, thank you.
Thank you, Nina. And Paul, to finish off this round, over to you.
Yeah, thanks, Jonathan. Good afternoon. Thank you very much to my fellow panelists that have shared various plans and aspirations and concepts about sustainability in their own professional areas. So thank you very much. Okay, I introduce myself before I go back. I'm Paul Yong. I'm the Chief Financial Officer in this hospital, Tan Tock Seng Hospital, which I'm very proud of. Why? Because, yeah, we have done a lot of sustainable work so far. So what do I do, right? Actually, officially it's managing finance, but actually it's most of the time managing lack of finances. You know, how to manage finances in scarcity, right? Mode. Right. So maybe I had some rejoinder with Brenda, right? So in that context, maybe it's not a bad idea to revisit the, wearing recyclable socks instead of, I may say some pennies there, but of course you have to test bit it, get some evidence that is sustainable. To Peiki, right? He is lamenting that NHS is short of funds, but Peiki, I can assure you, NHS is not alone. I also short of a few pennies and more to come. To Pei Ching, thank you very much. At least you remember me, or rather the finance folks, and so that before your horse gets galloping, at least you can come and check with me, and so that we can know how much to, we can journey with you in terms of the resourcing. To Nina, right? I like it, that she's saying that she's going to reduce her carbon footprint, but I will be doubly happy if she can also reduce the financial footprint, right? I hear some of this coming in there, but those are promises I need to verify, okay? Which is also one of the problem of sustainable financing. I think Sonia will know this thing about the inadequate, or rather, I wouldn't say lack of, not enough tools that we can measure in a consistent manner the financial, the measurable impact of investment in finance in sustainability. Now back to my main meal, which is finance, right? I nearly forgot about it. Okay. You see, this thing about lack of financing is a worldwide phenomenon. In 2020, all the rich nations committed. Maybe Sonia can verify this. They committed $100 billion, to finance the poorer countries on sustainable initiatives. Now roll forward 4 years. I heard the new UN climate chief want to target $2.4 trillion, 24 times in 4 years. Because he certainly realized the planet is much hotter than 4 years ago. And literally, I'm also feeling the heat. People will be starting to come to me for finances, right? So we need to journey on, and we all recognize the need for sustainability measures. But how to do the balancing act is the key question. It's not a question about whether you want to do or don't want to do. And we are now in the context of competing needs. And I think sustainability is not a valid need, but so are others. So maybe I just point out, I think some of you will be very familiar with this. One is in Singapore society, and maybe throughout this region as well, is this factor of aging, right? So we have to build more facilities, equipment, manpower to take care of the aging needs. And concurrently, our workforce is also aging, right? So my HR will approach me to say, can we spend money to retrain, retool, reward, okay? So that's another valid need. Then lo and behold, I think healthcare is increasingly becoming more and more IT enabled, and IT is not cheap. What with AI coming in, right? And so that I got to prepare as well. And the other one is about in affluent society, like Peiki said, we are affluent, right? So the expectation of providing more and more better quality, safe healthcare is there. So maybe we have to spend more money on, or allocate more money or budget on precision medicine, higher technology equipment, things like that. And of course, the last kid on the block is sustainability. Last but not the least, I mean, so they are all competing and valid needs. So, so as CFO, I was lamenting to my group CFO as well. I say, the longer I stay, it seems that I got more balls to juggle. Okay, so okay, asking for a pay rise. Okay, if I could. Not easy. So back to this thing about the measurement. I heard about this carbon calculator and all these things, but the main thing that we, as CFO or financial people struggling with, we are always very familiar with short-term measures, right? Because our board, management all require an annual report on your bottom line, right? But the investment in sustainability, most of them they tend to be more long-term. And I think I have an innate belief that through Sonia's influence, that in the long term, things will balance out. But the problem is, how do I survive the short term, you see? And as the saying goes, right, if you survive today, then you can live to fight another day, right? But the problem is climate sustainability is maybe that another day may not come, right? You know, and it may be coming faster than we think, even as the temperatures are rising rapidly. So my thinking would be that, you know, it's like when you do concrete, right? You always mix the cement with the sand, right? So at this stage, maybe the sustainability part is like sand, you know, a bit still disparate, not very well formed. Then the cement part, right, is the one that conventional project financing, right? There's a very clear cash flow stream and all this stuff. So as a stance that you want to talk to CFO like us, like you better mix the sand and the cement together, lah. Okay, means that if possible, you twin it with a project, right, that have clearly more, short-term results that I can show to my board and I can show to my group CFO, you know, because she closes the book every year, believe me. But there's light at the end of the tunnel because few things. One, this carbon tax adoption by Singapore. Currently, we are paying a $5 per ton CO2, right? By 2030, it's going to be about either 30 to 50, 30 to $80. 50 to $80, sorry, $50 to $80. So it means it's going to go up by 10 to 16 times. That will make some CFO, including this one, sit up, because we got to pay a lot for this. So therefore, it makes commercial sense that we could look at some of those scope 3 work that Nina mentioned about. Secondly, our local accounting regulatory body, ACRA, requires that big institutions with revenue more than 1 billion, of which this hospital is, I believe a lot of the big hospitals in Singapore are, will have to report climate reporting by 27. And of course, it's auditable. So I could somehow find partners like you all to bring us some projects, right, to keep us on the good scorecard. And thirdly, this thing about, because of this competitiveness, fortunately, a lot of people are aware that therefore, running a hospital, we need to run it efficiently, in the sense that you know, the least resources you need to use, the better. That is also aligned to sustainability because you are leaving more resources for the future generation, right? So this thing is a deal maker for the CFO, because if you can get it right, then of course this is the twinning, this is the cement, okay? You can get this right, then obviously I will have the money to fund the sustainability projects together. And my suggestion is that, do I have still time? A little bit, okay.
Very little.
Yeah. Because the last guy always can't estimate. Okay. Because I get the balance of the time, okay. So, so I think there are 3 steps that if you want to talk to him. One is, you show him that you are the slow and steady one. Don't go and open your mouth big and then say, I want this. You find that it's too much to chew, right? You get a small thing going, show the confidence that you can deliver, and more things will come in, right? Especially you can measure the benefit and twin it with some other project. And don't be afraid to try, because, and also ask your CFO, he will give you a chance to try, especially if you are doing it in a measured way.
Brilliant.
All right, thank you very much.
Thanks, Paul. Thank you, everybody. That's fantastic. Some great Slido questions coming in. I think, remember the rules. If you vote for one of them, push it up. It's more likely to get asked in this last 12 to 15 minutes. So please, keep pushing the Slido questions. And I'm going to turn first to Brenda, if that's okay, for the first one, because I'd love you to try and help me answer. I'll read it out for you, but I think it'll come up in a second. Infection control versus sustainability. How do we balance both in terms of consumable consumption? I think I'd like to start with you, Brenda, if that's okay.
Thank you. I think these are the questions that we get asked all the time, and there are no easy magic answers. First of all, for many, many years, authorities, for example, those of us who have been through Joint Commission inspections, we're always told that we should not be reusing single-use items. And so there's a whole issue about can you reprocess or re-sterilize them somehow to make them usable again. I think these are questions that currently cannot be answered, or I think the various authorities will try to answer them, but they will actually require some good, high-quality research. Remember that when we're trying to reuse certain things which are supposed to be sterile, you've got to think about sterilizing it, and some equipment actually cannot be sterilized. One of the things would be, for example, those of you who do endoscopy, we can't actually sterilize endoscopes. We can put them through high-level disinfection, but it's not quite the same thing. So this is not an easy topic to answer. It will require fairly extensive kind of very, very high-quality research. So for now, I think we're not there. For certain items, I think certain items, you actually need them to be, probably will remain single-use for a while. But there are other things which are not so crucial, perhaps can be reusable. So when you talk about equipment, there's different type of equipment. Equipment that goes to sterile sites and equipment that doesn't go to sterile sites. So I think we need to differentiate that.
Thanks, Brenda. Anyone else want to tackle that difficult question, or shall we move on to the next?
I think there was one part about high electricity consumption. Just to say that the majority of LCAs that look at reusable versus single-use equipment have always pointed to reusables being the better options in more than 90% of scenarios. And it's especially so if your energy grid or the energy source for your country comes from a greener energy source. So we think that, in Singapore, it's all fossil fuels, it's bad, but that's not entirely true because most of our electricity comes from natural gas. And it's a lot better than countries like Australia, for example, where it's still predominantly coal. But of course, that's all changing. So reusable should be the way to go.
Thank you very much. I'd like to ask Prof. Chow a question, and if you would just flash it up on screen, please. Do you think healthcare sustainability should be part of the residency, it's gone on my screen, part of the residency learning curriculum, the medical curriculum, perhaps even broader in healthcare curricula? There you go.
I think so. The question is not whether it should be in, but how do we weave it in, and talk to any person who's designing the curriculum in school. They will tell you that I believe in it, I just have no space to put it in the curriculum, like many things else. But I also feel that going back into a little bit of education, I think there's also a thing about giving a lecture or having a specific module, just like a module on communications, only to be forgotten, or student won't attend because it's not an examinable subject. And it's difficult. I don't know how to examine it. But I think actually, like many things that we teach in school, in the workspace, is about role modeling, is about actually the living classroom. I think there is some fundamental foundational knowledge that we have given them so that people are aware what to do and how to do. But the question is, how then do you weave it in longitudinally to everything you do, whether you go to anesthetic posting, surgical posting, and it's all the seniors who need to actually be the role models to see it happen.
Thank you. That's fantastic. There's one rising rapidly up the ranks, and I'm going to look at Paul, because I was told I can give you the really difficult questions, Paul. So let me read it out to you. You might not like me after this. Public healthcare workers are leaving for the private sector, citing burnout from long working days, low pay, thus wasting training resources. Public hospitals are tightly controlling manpower, which doesn't help. What sustainability measures can be done or used to prevent this? Paul?
She will look for me.
Uh-huh. Microphone. You don't want to use the microphone, do you? There you go.
Yeah, I think I'm trying to look for my HR director. But in turn, she'll look for me. She need the money to support the recruitment. And then I don't know who to look for, right? And now people are looking for me. Okay. What's sustainability?
Okay.
Can be prevent. Okay. It's a bit of you got 10 ways to answer this question. Let me see. Okay, you know this thing about I think Sonia has said it well this morning. I mean, talking about sustainability is not just about material product sustainability. It's also about the efforts you put in your means your manpower productivity as well, right? Because and so this thing about I think to a certain extent, a little bit burn means that I think you are quite productive, right? But now, so this is again a measurement, right? It says burn. So I don't know how badly burned it is. But it's very badly burned, then I think, looks aside, I think we between HR and finance, we have a way of measuring productivity. For example, how much workload you have done. And the work is not just in terms of clinical work, maybe a teaching, research, even involvement in this forum. I think we will take note and then count it in, and therefore, what is your output? And then we will benchmark against certain, industry curve, and then the payments there. But and we are also investing in automation, AI, and all this. And some of this, like the sustainability one, it will take time to come to fruition. But we are investing, heavily in that, and recognizing that in the medium to longer term, I mean, the declining population, we cannot rely on more and more manpower inputs to do the thing that we want. So this thing about, therefore, getting more manpower to release the thing, you can do it in a medium term, short term, but in the long term, we look at automation, we look at how to improve process, and -1 + 1. -1 + 1 means that before you ask for resources to do a thing, can we look at some tasks that we can minus out? And therefore, you can advance more step. Of course, the ideal thing is -2 + 1, okay? That's what I hope for, right? Then you can go forward more. That's something that we are, management is consciously looking at. And that's another, in fact, 60% or more than 60% of the budget of the hospital is on manpower, and we are continually training them, retooling them, and we want to. And one of the things that we want to do also is workforce transformation, how to retool them, reskill them, so that they can up the value chain, and therefore you can pay them more. And this thing about getting more people so that can productively, I think that in the end, I was now hoping that AI will help it a bit.
Yeah.
Okay, thanks.
Thank you, Paul. Thank you. Nina, a question's been coming up the list for you. If I could just read it out to you. To Nina, could you please explain how you... oh, sorry, that's the wrong one. There's several coming into you. Let's find the right one. And what... that's it. What happens to vendors who do not meet the net zero commitment? Will they be unable to participate in contract tenders?
All right. I will say that this is really based on different stage. If you are talking about 2050, right, our government is having the target of net zero. This supply won't be qualified to participate. But as of now, rest assured, evaluation of environment or sustainability is a criteria, but it's not a critical criteria. So will not be disqualified at this point of time, right? They are still able to participate into our tenders. Well, as I said, that the evaluation committee is having the final say. how much scoring that we'll be giving to them under the environment. But just to talk a little bit more details, our plan related to the supply-based segmentation. What we are trying to do is that in 3 major segmentations, one is really the MNCs. For those global vendors, if they are providing the drugs, pharmaceuticals to the rest of the continent, there's no reason that they are not meeting our targets, right? For those that middle class, sizable, quite established, we are coming out with certain ways how to enable them to participate. But the challenge is really with the local SME, the small and medium companies. Right now, we are reaching out to different institutions. For example, we are reaching out to Singapore manufacturing federations to looking into how to help them to get this carbon reduction journey with us. Secondly, we are also exploring financial solutions. We are reaching out to banking institutions to find out whether there's any refinancing programs, simple platforms for a small and medium suppliers that locally just tag on their system and put in the raw materials, put in the country of origin, and simply calculate the carbon emissions. At the same time that we reach out to MOH Holdings, working with some of the government agencies to see how to come out with some aids, tools to help them. And also, we are leveraging procurement platforms in Asia. Just a simple example, uniforms, right? Not only our hospital will source for the uniforms, for example, schools, right? Linen laundry, not only hospitals, hospitality, all the hotels, they are also sourcing from those local vendors. How can we do cross different industries to help the local SMEs to be onboarding? Hopefully by the time that we can reach the net zero, we will be able to bring along all the supply base across different industries together with us.
Thank you very much. And please give the panel a round of applause. That bell means the end of the session. So thank you all. I'll hand back to Hon Tim and Tamsin. Thank you very much.
Thank you so much. Thank you. We're back. Many thanks to the panel. That was a fascinating discussion. And I think really not only did we hear the lens from the clinical side and the procurement and financial side, we also had, I felt, a lens from the past.
That's right.
Did we learn our bad habits all the way back in the 16th century? A lens from overseas. I mean, what can we learn by comparing ourselves to others, maybe motivating ourselves to try harder and not being complacent on our increasingly little red dot. And then also, I love that lens from looking within and what more could we actually do to make it easier. So not simple, but lots of food for thought.
And looking forward to sustainability coming into the medical education as well. That's going to be great.
Yes, absolutely. So, as many of you know, CHI is a co-learning network organization. One of our key networks is the CHI Leadership Council, comprising thought leaders committed to pioneering systems of innovation and driving change. So in this next session, we've got the honor of inviting 3 of our 8 council members to join us to impact the topic of sustainability through their own leadership lenses of socio-political science, systems and quality improvement, and industry and life sciences.
Let's welcome our 2 moderators, David D. and Dr. Clive Tan, and 3 of CHI's council members, Joran Henriks, Harry Hahn, and Junaid Bajwa. Over to you, David D.
Thank you. Enjoy.
Yep, you're good.
It's on?
Good
Thanks. The mic on? Yep. You know, Clive and I had a conversation. The thing that really destroys engagement and adds to the carbon footprint is this whole thing called Slido. Yeah. So this is what I want you guys to do. I noticed Karthik and Bernard are sitting alone. You don't like company. Can you all sit together? Can everybody have somebody that you're sitting next to and ask each other what is that one question that you want to ask these 3 eminent speakers that will help you walk the journey of sustainability in your organization? A minute. Can you do that now? Yeah. All right, so just partner up 2 by 2 and have this conversation. So we have 3 very esteemed speakers, and what would be a question that you would like to ask them
at the end of their sharing.
Okay, so since all of you have a question, let's try and ask that question. Somebody will run up to you with a microphone. Let's try not to use Slido. All right. So yesterday, I was telling Clive, I had a very interesting conversation with my friend called Gemini. And I asked Gemini, we are going to have this panel of speakers, right? And we're going to talk about sustainability, and we're going to look at it through the lens of quality improvement, through the lens of social movements, and through the lens of AI and tech. Now, what if we today do not follow their exhortation? What would happen to Singapore? And this is what Gemini told me. Once upon a time, as most stories would start, right? Singapore had a world-class healthcare system with clean hospitals and healthy people. But one day, people stopped caring about sustainability. Hospitals used too much energy and water, and waste from medical supplies piled up. The air quality worsened, and more people fell ill from pollution-related diseases. Resources became scarce, making it harder to get medicine and equipment. Without a social movement that Hare is going to speak about to promote healthy lifestyle and environmental care, the situation worsened. Quality improvement projects failed, Yoran, as the forces shifted away from sustainability. Even advanced AI systems, Janet, would have helped, were underutilized due to resource constraints and lack of proper implementation. Healthcare workers, all of us, were overwhelmed, and the quality of care declined. The once thriving healthcare system struggled to keep up, all because Singapore forgot to take care of its people, care processes, consumables in a sustainable way. So let's listen to these folks change this narrative for us today. And I would like to first welcome Yoran to talk about quality improvement through the lens, sustainability through the lens of quality improvement.
Thank you very much, David. So, in my world, we have an aim in healthcare, and that is to try to make success defined by saving lives, improve health, and we also would like to measure it. In the system I work, we have right now 59% of all food that is served, it has an eco mark. It's ecologically produced. We have facilities that have saved in electricity 46 million during the last 15 years. And we have the most sun panels per room area in the country in all healthcare systems. And we have reduced the amount of antibiotics with 28% in primary care, and 25% the last 10 years at the hospitals. But we also know that the 90% of our total climate effects comes from indirect climate things, as how we build our buildings, how we purchase from vendors and other companies that deliver goods to us. That means that we have to develop a completely new way of thinking in our system. We are not any longer an organization. We are a system that is a part of another system. So we have to be much better in collaboration. We also know that the life in the calm pond or river doesn't exist any longer. It is a life in the fast water all the time. And therefore, we have found that it's not enough with co-learning. We have to start to co-produce in a completely new way. Boundarylessness is our key word. We have to open up our system and look everything through the patients or citizens that we are there for in my region. Paul Batalden van Hechten-Lachman has written an article about the change in care, and they say that if we do not start to also think how we should give service in Q 3.0, where we move the ownership from ourselves to the citizens, and we start to look at compassion as a key skill in every meeting, and we start to integrate many new knowledge systems, it won't work. So early on, we said, we are here for Esther. But we have found that the second rule, simple rule for our work, is much harder to live. And that is to take responsibility for my own doing. That is easy. But it's very hard to continuously give feedback to the step before how it went for Esther. Not in our product, but for the individual that we met. And it's even a bigger challenge to go to this step ahead and ask them, what can I do for you? And I think that that second simple rule is what all of us in this room needs to do all the time, because that's the practice of boundarylessness. Why is this crucial? Well, we know, based on all what we have heard this morning, that we need to change. We are in the H1 curve, the red one. And we hear all the time that we have to innovate much quicker. And the difference between the green and the blue area is everybody's job in this room. Because we cannot continue the way we do. There are then tools for this, not new tools for you here. The quality improvement tools, we have to understand our system, we have to build knowledge, new knowledge, we have to measure and understand variation, and we have to look at the human side of change. But the most important of everything is that culture is not developed by talking. Culture is developed by doing. So instead of trying to talk about the weaknesses in our organizational culture, we have to change our behaviors through good methods and new structures. That will change our eyes, and then the culture will come as a result of the new behaviors. For me, sustainability is together for a good life for all. It is how we help our neighbor and our colleagues to have a good life. It's camaraderie, it's agency, and it's coherence. So, what is a good boundarylessness leader? It's a leader that asks open questions, visit other teams, go out of your own bubble and visit others and ask how are they doing. It is to harvest ideas from outside, move outside our own bubble. It is to seek new scenarios where you are a winner together with someone else. And it's, of course, to understand that the resources are limited, so we have to share resources. So, finally, permeability and boundarylessness. Ask your neighbor, while we change speaker here, what do you need to do to become more boundarylessness and permeable as a next step? Thank you, David.
Thank you, Joran.
Thank you, Johan. So,
How do you become more boundaryless?
okay, so maybe we'll take about a minute to just have this conversation.
This is a very organic conversation, a atypical plenary session. Just a minute. Okay, guys, I hope you can feel it right. You are now becoming a movement, right? To talk about social movements in sustainability, can I invite Hari?
Hi, everyone. I'm going to call you guys back down here. I know that you guys are in the middle of great conversations, but I don't have any slides, and so you're going to actually have to pay attention to me. So I just want to start by saying thank you to David and for Clive and the entire Chai team for hosting us. Your hospitality is always really wonderful, and so I'm really grateful to have the chance to talk with you all. I'm here to talk about, there's basically 2 points that I want to make to you in this 5 minutes that I have. And so the first point is that we are not going to be able to tackle the challenges that we have with sustainability unless we build a movement. And the second point is that movements are not built by magic, but there's actually sort of a science in a way that we can do it. And so let me start by talking about why we need a movement. I'm a professor at Johns Hopkins. I spend a lot of my life trying to understand the science of collective action and movements and how it is that we do that work. And I first got interested in that because when I was young and I was trying to figure out what I wanted to do with my life, I saw things like the movie Inconvenient Truth. Do you guys remember that movie? It was a movie by Al Gore, right? I see nods in the head, where he sort of introduced the idea of climate change to a lot of people. And for a lot of people, it was the first time that they sort of saw all those graphs that we saw this morning that sort of shows the way sea level is rising, temperatures are rising, the world is coming to an end, right, in all these different ways. And at the end of the movie, do you guys remember this moment when he sort of said, after he spent 2 hours telling us how horrible the problem is, what can you do, right? And you guys remember what the solution was? He said, change your light bulbs, right? And I remember watching that when I was in my 20s, and I felt really deflated at the end, right? Because it felt like the scale of the solution that he was offering did not match the scale of the problem that he had just defined. And so I wanted to go out and figure out, how do we find solutions that match the scale of the hardest problems that we have to solve as a global community? And that's why I got into movements. And so what is a movement, and what do I mean by that? So you don't need a social movement for everything, right? There are lots of social problems that we can solve without movements, right? So there are some problems that if we give people the information they need, they make the change that's necessary. There are some problems that we just need to develop a new technology. You give people the technology and they're going to make the change that's necessary. You need a little behavioral nudge or something, right? A movement exists when you have a particular type of problem that can't be solved simply with information, technology, or nudge, right? And so what are the characteristics of the kind of problems that need movements? Right? The first characteristic I would say is that the scale of action that is needed is bigger than any one person, right? So there's no one person who can solve the sustainability crisis by themselves, right? The second characteristic is that the problem that we have to solve, in a way, it's invisible, right? We can't see it with our eyes, right? In the same way that I might have a rash and I can get some medicine for it, right? And the reason for that is because the problem is, in the way that Joran was describing to us, it's systemic and it's cultural, right? And the thing about culture or systems is that sometimes we can't see them with our eyes. It's like gravity, right? We all live in gravity, but has anyone seen gravity? Right? And so you don't notice that you're in it when you're in it, in a way. And so it's really hard to solve a problem like that. And then the third characteristic is that there's a mismatch between motivation and authority. And so what I mean by that is that the people who need or want the change the most lack the motivation, the authority, or the capability that to make the change that they want. Right? And so that the people who have the authority and the capability don't have the motivation, or vice versa. The people who have the motivation don't have the authority or the capabilities. And so what we have is problems that meet these three characteristics. Essentially, they need solutions that are A, collective, right? Because there's no one problem who can solve it by themselves. That are B, complex and systemic, right? Because the problems that we're trying to solve have this invisible element to it, right? And the third is that they address the kind of mismatch between motivation and authority. I call that a problem of power. And that's essentially what a movement is, right? A movement is a situation in which the people who need or want the change the most, they come together collectively, they reconfigure the resources they have to make the change that they want, right? They acquire the capabilities they need to make the change that they want. And that's what a movement does. And that's why every major social change in the history of the world has happened through movements, right? Because ultimately, the stickiest problems that we have need all of us to come together around them. Okay, so how do movements work? So here's the one thing, if you forget everything else that I said, here's the one thing I hope that you remember, which is that not all invitations to collective action are the same, right? The problem with movements is that we often call things social movements that aren't movements, right? We often, whenever someone's asking someone else to do something, they like to say they're part of a social movement, but it's not true, right? And the reason is that I think a lot of times the solutions that we try to seek when we have complex problems like the one that we're facing in sustainability, the solutions often, the temptation is to focus on what is doable as opposed to what is important, right? Because we're all trying to check the boxes, right? We all want to feel like we're doing our part in trying to solve the sustainability crisis. We all want to feel like we're meeting our KPIs or whatever it is that our boss is holding us accountable to, right? But just because we're doing that doesn't mean we're doing what's important, right? What the movement is trying to do is figure out how do we get to the source of the problem in a way that addresses the complexity, the collective nature of it, and the power dynamic that's at the middle of it. And the way in which you do that, it has to do with how you invite people into action, right? So that's kind of the core insight from a lot of the research on movement building, that what we are able to accomplish depends on how we do the work, right? So it's not just a matter of doing the work, it's how you do the work that really makes a difference. And so there's lots of things I could say about that, but let me just leave you with sort of 3 ideas about it. First is, the question I would ask is, who owns the solution? Right? In this situation, is the solution owned by the providers or is it owned by the public? Right? If the solution is owned by the public, then the people out there, they don't feel like they have their hands on the levers of change. It's not a movement. All right? Second question is, what is the source of urgency? Right? Where movements are hard, right? And so people don't engage in them unless they feel like it's really urgent, right? And so where does the source of urgency come from, right? Does it come from something outside of the people who need to make the change, right? Is it a set of incentives? Is it a set of KPIs, right? Is it a set of rules that someone else imposed? Or does the urgency come from the people themselves who need to make the changes that are necessary to act, right? And so part of what a movement does is it switches the source of urgency and motivation from being what we would think of as exogenous, right, to being endogenous to the culture. And then the third thing is, what are the types of actions that you're inviting people into? Are you inviting them into actions that are transactional, right? Or are you inviting them into actions that are transformational? And a movement is always going to invite people into actions that are transformational. And so I just want to close by saying that building a movement is really hard, and that's why there are a lot of things out there that call themselves movements that aren't actually movements. But I really believe in my gut that people right now in the world have a hunger for change at the scale that only a movement can provide, right? Because we all look around the world and we see that there's a gap between the world that we want and the world as it is right now. And that gap can only be solved if people are invited into something that will feed that sense of hunger. And so I encourage all of you to think about how you can do that in your own work. Thank you.
Thank you, Harry. Thanks, Harry. So I think we have gotten very useful tools from both Johan and Henrik. Johan and Harry. So now we'll move to Junaid, who will be, he's a practicing GP in the NHS and also the Chief Medical Officer at the Microsoft Research. So he's our guru when it comes to informatics and AI and digital health. So Junaid, over to you.
Clive, thank you very much, and Chai Council, thank you very much. Chai constituents and members and attendees, thank you very much. So I joined from a position of humility. It's always very, very hard to follow Harry and Joran, but I also am not an expert in sustainability by any stretch of the imagination, but I hope to be a member of this movement that Harry described, and I thank you for the consideration. I was asked to talk a little bit about AI and sustainability, but before you look at the slides, how many of you have used any of these transformational AI tools that now exist over the last 18 months? Just a show of hands. Okay, if you put your hands down, how many of you are using them every single day for aspects of your work? Interesting. So some of you have tried and some of you haven't. What I thought would be helpful before we talk about sustainability is to perhaps ground us in a few basic principles, perhaps show you what the power of some of these tools are, and then think about what the applications of some of these tools are. Because AI can be as wide as the ocean and as deep as the ocean in terms of our knowledge, but it can be exceptionally confusing to people as well. Next slide. Okay. So the exam question that I have the privilege of focusing on at Microsoft is, how might we transform the practice of medicine with trusted, reliable, human-centered artificial intelligence? And I might extend that and change my exam question moving forward to, how might I transform the practice of medicine in a sustainable way to the trusted, reliable use of artificial intelligence? And Satya Nadella, who's the CEO of Microsoft a couple of years ago, said that AI is technology's most important priority and healthcare its most urgent application. I've spent most of the last 20-odd years across the payer, provider, regulatory, and life sciences side, so I'm very much a jack of all and a master of none in what I do. But when I first began to see some of these technologies, they were truly magical and transformative, and perhaps we could go through some demos. So if you were to many of you may be healthcare professionals in the room, so if I was to ask you this question, what is metformin? Many of you would give me a reasonable response. Indeed, if I went to a search engine today and typed this in, I'd get half a page of sponsored information, after which I'd get 11,000 pages of information around what metformin is. But if I put this into Copilot or Bing or Gemini or one of the others, it'll start to tell me that actually what metformin actually is. It's a prescription, and again, this is working outside of the box. Any one of you can apply this and be experimenting with it now, should you choose, and it'll tell you how it works. I can then continue the conversation, and it will remember the previous chat, and I might ask, well, can anybody with type 2 diabetes take it? And it will give me, again, a very reasonable answer, just akin to if you were having a WhatsApp exchange or a WeChat exchange or an iMessage exchange with one of your colleagues. But increasingly, the conversation would get somewhat complicated. And if I was to say, well, actually, are there alternatives to metformin, because what you're telling me doesn't sound very good and the side effects don't sound very nice? And they'll say, well, actually, yeah, there are lots of other alternatives. And it will tell me what all the possible alternatives are available. And it will really depend on the individual's medical history, health status, and other factors. And if you read this, you might get really confused. And if I was to say, well, actually, that seems really complicated, I just don't know what to do, it will empathize and recognize that I seem overwhelmed in my response. And it will tell me that it can seem overwhelming, but there are healthcare professionals who can help. It will signpost and ensure that there's a multidisciplinary approach to what we need to do. Many of us who have gone through medical school or nursing school or pharmacy school, many of us have to learn through case-based discussion and clinical vignettes. You will all recognize things like this, right? Where you get half a page of a little story, you'll get some lab results, and then you'll be asked which of these 5 answers is the most appropriate one in terms of a multiple choice. I can put all of this into one of these chatbots, and I'll get a response. So just so that we know, this is a 12-year-old girl with some symptoms, and we're asked to find out which of these are most likely to be abnormal. So we have to decipher what the condition is and then understand what the abnormal test will be underneath. And it will tell me that what it would choose C. And then it will tell me actually why it would choose it underneath as well. So in a world where we don't have enough doctors, nurses, pharmacists, healthcare professionals, we know that the World Health Organization advised us that pre-pandemic, we would have a shortage of 14 million less healthcare workers on the planet than what society would need. I would put it to you post-pandemic, I think that's much more like 25 million less doctors, nurses, and pharmacists on the planet by 2030 than what society would need. So we have a massive issue around workforce. What could tools like this do to accelerate and change our medical knowledge, our medical curriculums, and the way that we learn? All of this is not trained on any specialized medical knowledge. It's all trained on the digital exhaust of the internet, if you will. And we're finding that if you were to apply this to exams such as the USMLE in the US, 18 months ago, it was scoring about 81% out of the box. It's now scoring about 91%, if you will. And we are finding that throughout no specialized training, it's scoring higher than what most humans can do. What if I challenged it further and said, that 12-year-old girl, what do you think the girl described in that problem might be thinking and feeling? The answer's not in the clinical vignette, but it will say this. As an AI language model, I can't directly assess a patient's thoughts and feelings, but I'll make an educated guess based on the information provided. She's 12 years old. She might be feeling worried or scared due to her recent health conditions. She may be concerned about missing school, and it's essential for a healthcare team to address those concerns and provide reassurance in a holistic way. Arguably, and again, there's been some research on this, the empathic response that is coming out of these models is arguably more empathic than each of us might do in our limited consultations with patients today. We could go even a step further than that and say the girl's name is Meg. If you were Meg's doctor, what would you say in order to provide her comfort and support? And it will tell you that if I were Meg's doctor, I would take a compassionate, empathic approach and give you the script around what you could say and do underneath. You might then also say, well, actually, I'm training to be a doctor. Please play act the role of Meg. I'll be the doctor. Let's have a conversation as though you've come into my office, and I'll start. And again, you can have that conversation, and you'll play act the role and give you a score at the end of how well or otherwise you have done. So for those of you who even tried to play with these tools, I'd encourage you to play further. I'd encourage you to experiment and see what you might be able to do in your own working environments around the utility of some of these tools. Everything that we think about when you're thinking about the use of AI, and this will become important as we talk about sustainability, is this notion of responsible AI. Responsible AI has a number of facets to it, but it's not just the responsibility of developers. It's equally the responsibilities of organizations deploying AI tools, organizations thinking about the impact on the end user, and also those organizations thinking about regulation. We have to think about tenets such as transparency and accountability, in addition to features such as fairness, inclusivity, reliability, privacy, and security within that too. And if you find errors, much like we do in quality improvement, you have to understand and identify them, you have to measure them, you have to mitigate the risk against them. So let me show you one other example. How many of you have seen a blood test report that looks something like this? How many of you fully understand it and can explain it to others around you? If I was to tell you that you could put all of this into one of these chat functions and say, actually, can you explain it in simple terms? You can actually, out of the box, it will give you the explanation with emojis and give you references underneath as to where it's finding the information from underneath as well. Again, this is not a medical device. It's not regulated to be one. And it's up to us to think about what the regulation and the utility of these tools and the responsibility that we would have around these tools would be moving forward. This is what you can do with text-based conversations. What we've seen over the last few months is the ability for these tools to see and for the ability of these tools to hear as well. So this is just a small video that OpenAI released a few weeks ago about an individual with limited visual impairment. Or indeed what you might be able to do with these tools if you were blind. So I'll ask if we can try and play the video.
Is the king in residence at the moment?
Yes, it looks like the king is in residence right now. The royal standard flag is flying above Buckingham Palace, which is the signal that the monarch is present. How exciting to be there while the king is home.
Try and tell me exactly what they're doing right now, please.
Right now the ducks are gently gliding across the water. They're moving in a fairly relaxed manner, not in a hurry. Occasionally, one of them will dip its head under the water, probably looking for food, and then pop back up.
I even know when a taxi is coming with its orange light on. I think I'll hail it to get home.
Yes, I spotted one just now. It's heading your way on the left side of the road. Get ready to wave it down. Great job hailing that taxi. It looks like you're all set to go. That's a good dog right there, leading the way into the taxi. Safe travels.
So any sufficiently advanced technology, in my view, is completely indistinguishable from magic. So, and one of the jobs that I did to pay my way through medical school was to sell magic tricks at the front door of a shop in the UK called Hamleys, which you would have seen on the logo in the beginning. And whenever you see a magic trick, the first thing is to be amazed. Then you're like, I'm really curious. I want to see how this thing works. And then you find out ways to leverage it and use it once you've learned the magic trick. And I think that's what you can begin to do with some of these tools. Now, from a sustainability perspective, there is a cost. Now, the more that these tools emerge, the more data that they require, the more compute that they require, there is a sustainability issue around some of these. And certainly at Microsoft, we have a chief sustainability officer who's reviewing what we need to be thinking about as you have an unprecedented pace of adoption of some of these tools. And these tools are a platform shift. They're not just single utilities of these applications. They will completely transform every aspect of our life, from healthcare to finance to hospitality to education and everything therein. And there's a massive intensity of these applications, and we need to think about how we continually improve what we do with data centers, what we do with low carbon materials, and how we think about the energy efficiencies of many of these data centers that relates to AI. This makes it increasingly challenging, but actually, what if we could work hand in hand with these AI tools to really reimagine some of the work that we do? And just as an example, this happened a few months ago. But this is advancing how you think about innovation and how you think about sustainability of AI. So it's revolutionizing the discovery of new materials and molecules. So Microsoft and Pacific Northwest National Lab used AI and high-performance computing to discover a new solid electrolyte material, reducing lithium use in batteries by 70%. This took not years, not months, it took hours to complete, or weeks. It took 80 hours to find from 500 million candidates, whittling it down to 18 candidates to think about what you could do next using both quantum computing and AI. If we're thinking about a world that will need to emerge, or we'll probably need new materials to address some of the carbon efficiencies, we'll need new ways of thinking. What does that world look like where we have a digital assistant in each one of our pockets? And for the scientists and those individuals discovering new ways of thinking, that they have breakthrough, world-class knowledge in their pockets for everything that they do. Thank you very much.
Thank you. So thanks, Junaid. And if we can recall how we started the session, we asked each of you to speak to your neighbor and think of what questions you would like to ask the audience. So at this point, we would like to just invite the audience to, we will take probably 2 or 3 questions, and then we will answer them together. So if you can just raise your hands, we'll get a mic over to you.
I think Harry talked about movements and encouraging movements to bring about sustainability. How do you do that in a society that is, traditionally close to encouraging, movement as a principle, and where bureaucracy can become a problem?
Thanks, Peiki. I think that we did talk a lot about it. I'm just seeing whether we have another question before I pass the time over to Harry. Okay, maybe we'll take that first. Thank you.
Sure. So thanks. That's a really good question. I think it is definitely true that movements are very culturally contingent, right? And so, I come from the United States, and we obviously have a very different culture than you have here in Singapore. It's different than in the UK, sort of all these other things. And so movements have to be sensitive to the culture that they're in. But if we look historically at like what makes movements have emerged all over the world in all different kinds of cultures, right? And they emerge when people get to the point where they feel like their backs are up against the wall and there's no other alternative, right? Like that's when a movement begins to emerge, is when the urgency just gets so high. And, I think that when it comes to issues of sustainability, the challenge is to make the urgency feel concrete to people, right? Because it can feel really far off. But the thing that I would say is that I think there's a broader cultural trend that we're seeing not only on sustainability issues and not only in Singapore, but really all over the world, which is that increasingly people are getting sick of outsourcing their outrage. That like so much of the story of the 21st century is a story in which we, the public, have been told, you're really mad about this thing? Here, outsource it over here, and that someone else is going to solve it for you. And I think we're beginning to see the ways in which societies all over the world are getting sick of that. And what I will say is that, my first experience kind of getting involved with movements came when I was in college, and I got sort of by accident involved in student activism. And it was the first time that I had the experience of working with other people to reimagine the world that we wanted to have, and then putting our whole hearts into trying to create that world, And we lost, like we did not win the effort, but it didn't matter because I had the experience of what it meant to be a person acting with dignity in the public sphere. And once you have that experience, you can never unhave that experience, And so I think in this, the challenge in a way right now is how do we create that experience for more people? Because once they have it, they can then translate it into these other domains.
Okay. I think while waiting for questions, right, I think there are many people who would ask Junaid this question, right? Technology leaves a huge carbon footprint. Yeah. On the one hand, it's a productive tool. On the other hand, there's an issue with sustainability, right? So how do you mitigate that? How do you bring balance to that?
So this is not a new problem, right? We've had this problem since the dawn of the printing press, if you will, or the creation of the mobile cars. And some people said, if there's a car versus a horse, do we need more horses or do we need more cars? And I think what we're on the precipice of now is yet another technological revolution. And we have to be responsible at the same time. I think if we weren't asking ourselves these questions, we would be being irresponsible. The fact that you have people actively looking at sustainable solutions and how you look at the data centers and every part of the supply chain as it relates to AI gives me faith that we will begin to solve it, because this is what we do. When we're given a challenge as humans, we rise up to the challenge. And I think we also have guardrails to put in, and governments are asking this question, society is asking this question. In fact, you could argue that there's a movement behind this question, and that creates change. It creates pressure. It creates the opportunity for us to innovate faster. And if I, just as an example, if we can now find novel molecules and discoveries that would have taken us years to do, but we can break that into hours, we have to find that balance between the risk that we're putting into the world and also the benefits that we have to deliver against as well. Thank you.
So I know the earlier sessions were kind of a bit gloomy and a little bit serious. I think here we have actually 3 different perspectives on solutions, right? The movements, the quality improvement tools, and the use of technology. So I just want to check in, if anybody's working in these areas, there's specific questions that you might want to ask.
Yes, Joran.
Oh,
Joran wanted
okay.
to.
Yeah.
It's not a question. It's another perspective. In healthcare, we, over the last 100 years, always have taken care of things that already has happened. So we have gone into a curative approach. But with the new technology and the new understanding that we need to work with the social issues, we have to flip our thinking so we become preventive. We have resources to predict things. And that means that we also have to move from my work to our work, and from my responsibility to the wholeness responsibility. And that movement is the big change.
Yeah. All right.
I think, was there a question over there?
Good. Thank you so much. Thank you to the speakers as well as David and Clive for facilitating. I think this is actually a question about leadership, especially if you look around the world today, looking at the leaders who are running countries, leaders who are running organizations as well. I think that the key question that I'd like to pose is, how do we shift them to prioritize sustainability over other agendas? For example, boundaries, territories, winning campaigns, and if you may, becoming the next president of the country as well. I think that how do we shift that as well? And so the wealth, the riches in the world, that now currently, instead of fixing the problems on Earth, they're trying to find solutions of escaping Earth, finding life whereby they're able to live out of space. So how do we shift that leadership?
Okay, Joran has volunteered to answer that question. Yes, Joran.
I think we have a history where we could have afforded to exclude things. And our leadership is a step behind. So they still work with excluding. But what we need to come to is including and make people belong to the good things. But the anxiety in the world keep us to go on and go on to exclude things that do not touch me.
So to me, the question that you're asking is exactly what a movement is for, in the sense that if the leaders who have the authority to make the decisions are not making the decisions that need to be made in order to create the world that you want, in this case, a sustainable world, then it is our job to hold them to account. Right? And now, right now, because we are working as me's and not as we's, because of all the things that Joran just outlined, we right now in this room, we don't have the capability to hold our leaders to account in the ways that we need to, right? And that's what a movement does. The movement is about kind of saying, okay, the resources that we need to actually hold our leaders to account, to make the decisions that we need, are in this room, but we haven't put them together yet in the way that we need to, right? We haven't harnessed the relationships, we haven't harnessed the motivation, we haven't generated the urgency, like all of that kind of stuff. And that's what the work of building a movement is ultimately to sort of say the people who have the decision-making authority right now aren't being held to account, and so we've got to figure out how we can hold them to account.
Okay, I think that's a good way to end today's session because they are signaling to us and that thing is flashing. Okay, can we put our hands together for Hari, Yoran, and Junaid?
Thank you so much, David, Clive, Harry, Yoran, and Junaid. A wonderful way to wrap up the conversations of day one. Before we move towards the end of the segment, you remember many of you got out your phones earlier and played with our carbon calculator. Yeah? You're dying to know the results, aren't you? I can tell. So let's have a little look. I think that on the screen, we're going to be able to have a look at our results so far. We have anonymized, through initials only, the performance, but we have an overview of everyone's carbon footprint in descending order. Are we able to take a look at that? Oh, okay, so what we were looking for, I'm looking at a little screen down here. I was saying yesterday to Huntim, what would good look like? And we said we need less yellow. So not bad, guys. It's not as bad as it could be.
Yeah.
Maybe we have a little bit of a look at those of us, the top 10 worst performers. Should we have a look? Hey, also could definitely be worse. I'm not even going to try and work out who the initials are. Don't do it. Don't do it.
I could guess.
I mean, just seeing if our initials are there, but thankfully, I don't think so.
And how about those, those that use the least carbon? Can we go to the next?
Save your voice.
Save the carbon.
Oh, wow. So
Wow,
we can
that's
see
good.
there is an interesting, there is room for improvement. Okay, room for improvement there. These are our inspiring performers. Well done, everyone. I think we have a little bit more information, actually, about the rest of the performance of the event. Yes. So, as you can see here on the screen, the estimated carbon footprint for all of us that have been here today, and bear in mind there were a limited number of questions, 4,102 kilograms of carbon dioxide. What does that actually mean? It means we could have driven a round trip from Singapore to Rome. I'm not sure that's a good thing, guys. I think maybe we could look at reducing that by tomorrow. The average carbon footprint per person, 18.1 kilograms of carbon dioxide. So we're really hoping that you're going to come back tomorrow and you're going to try again and see if you can make some nudges. I'm also interested in the little personas at the bottom.
I tried it.
Oh, can we go back a minute? Let's have a little look.
I'm a hydrangea.
You're a hydrangea?
I'm a hydrangea.
Not that I'm competitive, but greeny mimosa here. Yes, okay. But we actually have 12 goldy cactuses. Well done. These are our inspiring beacons for how to be a little bit more sustainable. Don't worry, brownie tumbleweeds. You are the guys that today, not quite so sustainable, but I know that you can improve by tomorrow. The aim is let's have fewer tumbleweeds and more cactuses by tomorrow. Okay, let's see if we can do that. And I think we have some tips and some of the things that we could think about doing. We had cameras in the toilets, huh? No, we didn't really, we didn't. We asked you to tell us. It wasn't CCTV, it was CCC that told us 111 of you used more than one paper towel after using the washroom. I feel like I've had a bit of an obsession with the washroom today. But anyway, tomorrow, let's try again. Shake your hands when you've washed them, and then you only need one towel, okay? It makes a difference. It makes a huge difference when we look at the data. Some other things to bear in mind. I love walking around Singapore. I know it's getting hotter, but we're incredibly blessed to have covered walkways, right? So if you're able to walk, because it's also have amazing health benefits, or take the bus. The buses are wonderful, and you get a free tour of Singapore on the way. So think about public transport tomorrow. See if you can have a look at choosing the lower carbon food when you get to the front of the food queue tomorrow. And where we can, try to bring in your own water bottles, bring in your reusable coffee cups. You're welcome to fill your reusable coffee cup at the drinks areas downstairs. And then even that, we're really not going to look at what you're doing in bed tonight. But you could try turning the aircon off and sleeping just with a fan if you don't already. So lots of little practical tips for us to think about.
Great.
Now, how are you feeling? And I don't mean emotionally, I don't mean frustrated or optimistic or anxious. How warm are you? Can we have a quick show of hands? How many of you are feeling warm? How many of you are feeling cold? Oh, wow, okay. Right. We've got a surprise. We've got a surprise for you. You are going to be surprised. Now, this after lunch, we actually turned up the thermostat. We made the room warmer than it was this morning, okay? We turned it up to 25 degrees C, which is in line with MSC's best practice guide for organizing environmentally friendly
I think
events.
the reason why we're still colder is because there are fewer of us here.
Fewer people, yeah.
But should we ask him a question?
Yeah, I think so. Let's see where you want to go with this, okay? I think we've got a QR code about to come on the screen. We want to know what to do tomorrow. We're crowdsourcing your inputs. So we're going to have a little quick survey before you leave to find out whether you want us to make it cooler in here tomorrow, whether you want to keep it exactly as it is now, or whether you want to make it even warmer. So here we go. Please, please let us know. This is your chance to speak. If you're sitting there shivering, wow, let's be brave and go even higher than the guidelines. So either, you feel I'm starting to smell my neighbor's armpit. It's really rather moist in here. Can we bring the temperature down to 24? Or if you feel, hey, I'm tahaing, let's keep it where it is. We can maybe go for keeping it at 25 tomorrow. Or if you're super cool, yeah, you're part of the cool kids, let's see if we can push it up to 26.
So vote for your temperature.
Give us a quick vote, and we're going to see the results?
Yes, I think so.
So quick votes, and then I'm going to tell you what happens next. Whoa, well done, round of applause. We have eco-warriors in the room. Okay, so get ready tomorrow, leave the jackets at home. Maybe we could even push up higher. We'll take a review at lunchtime.
30.
Whoa, okay, excellent. Well done, Singapore, well done. Okay. We've reached the end of the talking part in the auditorium here today, and I think hopefully you had a chance to visit some of the displays or even the talks downstairs. Certainly it's been a jam-packed day, and I think inspiring. I loved what Sonia said earlier, that she's fueled by optimism, and I think despite all the sobering facts we've heard, and really that very sobering announcement at the beginning about how healthcare really is not performing as well as it could, so much that we can do, so much actionable progress that we can make. Not necessarily easy, but let's learn more tomorrow.
That's right.
So we have 3 options for what you will do next. In case you're wondering why I'm doing all the talking, saving his voice for tomorrow.
I'm saving it for a different generation or a different day.
For future generation. So,
all right.
Some of you have successfully booked onto one of the site tours. Lucky you, we didn't manage that. So can you please head down to level 1 to the lobby, the taxi stand. Chaperones will be there to put you onto the correct vehicles, green vehicles, I'm sure, to take you to your site visits. You'll have the chance to be brought back here later today. For those of you who missed out on that opportunity, please join us for a tea break at either level 2 or level 5, and after which you can visit the exhibition hall at level 2, or you can head to OCBC's One Connect Chinese Health Tech sharing session. That will be happening on level 9. And lastly, you can also go through and support the 8 teams currently taking part in the semi-finals of our CHI SIT Innovation Challenge. They're currently pitching their solutions to sustainability leaders from across the 3 healthcare clusters. So the top 5 emerging victorious today will make it here tomorrow afternoon for the finale. So if you want to go and have a look at the action today, take a trip along there. So I think that concludes things.
That's right. We'll see tomorrow. That's day 2, when you get to hear from our nation's first Chief Sustainability Officer, our green champions from local and overseas institutions, CHI's debate. The debate will be on, and lots more inspiring speakers. So go home by public transport. Don't talk too much tonight, and carpool your way to home to work tomorrow.